Good evening. We'll start this Friday with some good news. 40% of adult Ontarians will have received at least one COVID-19 vaccine by the end of the day. At the same time, though, Premier Doug Ford is painting a grim scenario, warning a fourth wave could come. And he's pressuring the federal government to tighten borders to protect the province from variants. But his message also diverts attention away from his own government's handling of the pandemic.
We need to be more vigilant than ever because this virus, it is changing, it is mutating, it is becoming more deadly, and God forbid we could one day soon face a variant that is resistant to our vaccines.
The Premier emerged from isolation at his late mother's home today, calling on the federal government to tighten airports and land border crossings, pointing out people are flying into Buffalo and taking a taxi across the border to avoid having to quarantine.
As long as these massive loopholes exist, we're not safe from these new variants. And I will not let this issue go.
The third wave, of course, has been driven by more contagious variants, which now make up 90% of new cases in Ontario. Workplaces have helped drive the spread, and the Ford government has been taking a lot of criticism it's not doing enough to stop it. And again, there seems to be a misalignment with Ontario's Science Advisory Table. It's calling for 50% of vaccines to be diverted to hotspots, where many essential workers are, for at least 4 weeks. The province is doing it for 2 weeks. The table is also calling for 10 paid sick days. The province is offering 3. When asked yesterday if 3 was enough to control COVID, the answer from the advisory table was blunt.
No.
Yet again, it seems like you're not listening to the Science Advisory Table.
I appreciate everything that the science table is doing. They also, there's 2 parts to this. I also listen to the medical advisors, the CEOs of hospitals, and most importantly, my chief medical officer.
Epidemiologist Colin Furness believes governments need to focus on stopping new variants from getting into the country and control cases that are already here.
I think the most pressing thing we need to do right now is to control transmission in Ontario.
Premier Ford warned variants could drive a fourth wave. What are your thoughts on that?
I think there's a really good reason why Mr. Ford is not a scientist. We may get over time some adjustment of the virus to be vaccine resistant. That's entirely possible. But I don't think we should be talking about waves. I think what's going to happen is our vaccination, our transmission control is going to drive COVID down, and we are going to perhaps see little brush fires here and there. We should expect to have a 3rd vaccination shot, maybe even a 4th one. So I think the end game is really long.
Doug Ford also addressed the Long-Term Care Commission report that is due today, which has been examining how COVID was able to spread through long-term care homes, killing almost 4,000 residents and 11 staff. I'm told it's being sent to the government right about now, and then it is supposed to be released to the public. The Premier said it will be hard to read, but he commissioned the report to get answers for families and to make sure it doesn't happen again.